Dr. Mufaddal Hamadeh is the president of the Syrian American Medical Society. His team was on a mission to the city of Aleppo and say their staff was inside the Idlib hospital when it was targeted by government airstrikes. He joins me now live from Chicago. Doctor, thank you so much for joining me. Talk us through what exactly happened to your colleagues as they came under attack in northwest Syria.
Yeah, thank you very much for having me here today. Just a quick, we need to identify SAMS first, what SAMS does. SAMS is a Syrian American Medical Society, and we're a non-political humanitarian organization that has been providing humanitarian medical aid to Syria for the last 13 years. We basically provide our medical services in all the areas, in the war zone areas, and we provide currently half of the medical services needed for 4.2 million people in Idlib. So when Aleppo, was taken out of the government control, we felt that there is a great need for help from our staff and team in Idlib. So our team have traveled to Idlib to the university hospital, where they were trying to help and assess the situation, and that the hospital, as we all know, was targeted with an attack, by an airstrike missile. Many people lost their lives there. One of our drivers, one of our staff, was injured in that attack. But that's not the only attack that our hospitals and clinics were suffered. Basically, the same day, the next day in Idlib, our hospital was attacked with a missile. 4 hospitals were out of service. Great damage happened to our maternity hospital and our pediatric hospital. This has been a pattern of attacking hospitals since the Syrian war started over 13 years ago. We were able to document at least 600 attacks on hospitals and healthcare facilities since then. And most of them were basically committed by the regime and the Russian Air Forces. Some were, very few were committed by the opposition forces. So we are very vocal when it comes to protecting hospitals and clinics.
Doctor, I'd like you to help us paint a picture for our audience of the scale of need at this moment. I'll read to you briefly a comment from the World Health Organization representative in Syria. Thousands of injuries have already been admitted in the last few days alone. Doctors and nurses working around the clock to save lives. And of course, at this moment, some health facilities have had to have no choice but to shut because of security risks.
Absolutely. So many of our facilities in Idlib were had to shut down because people felt very insecure, also for the safety and security of our patients too. But in Aleppo, the problem is also compounded by chaos that ensued after the after the going out of control from the government, is that the fact that many of the staff in the hospitals did not return to clinic, but to their hospitals. Many of the ancillary services were not available. So that was compound to the problem. Initial injuries were received, and many of them were received and did not get proper care. So the thing is, the most important thing now is people need to feel safe enough so they can go back to their work and be able to provide the necessary medical services that are needed for that city. Luckily, we have witnessed much worse situations during the siege of Aleppo and continuous bombardment. We don't have as many, medical emergency casualties, traumas this time as we had witnessed in the past in earlier years. It is something that we have to be very prepared for.
And Doctor,
because it may come any moment.
You might have heard our report from our reporter, Noor Komush, who was talking about the disruption to humanitarian supplies. How has that specifically affected the supply of medical equipment?
Absolutely. There is a great need for medical supplies, and that's what we're trying to do, bring some of those medical supplies from the city of Idlib to there. Basically, basic things like syringes, basically, IV fluids, medications. A couple of groups in particular that are very vulnerable is cancer patients and people who are on dialysis. So this is something that we have tried to address immediately now, and our team, our technicians, were brought in dialysis kits immediately from Idlib, and they start working on providing hemodialysis to patients who really need it. Their life will be in danger if their dialysis was interrupted. Same thing with the cancer patients. Many of their treatments have been interrupted. They need to be addressed, and chemotherapy drugs are not available. The problem also is access. People are not having, feeling safe enough to be able to get out in the streets, be able to get those medications and find the necessary medications. People who have chronic illnesses that need blood pressure medications, insulin, blood sugar medication, all those things they're very difficult to obtain right now.
Thank you so much, Doctor, for your explanation. That's Dr. Mufaddal Hamadeh, who is the president of the Syrian American Medical Society.
Thank you.